Minimally invasive spine surgery is a technique whereby the surgeon does everything possible to minimize any tissue damage during an operation. That involves smaller incisions, minimizing blood loss, minimizing any damage to the muscle, and getting to the spinal problem and fixing it in the most minimal and least damaging way possible. The best example of how minimally invasive spine surgery has changed my practice in spine surgery in general involves lumbar fusion. Open lumbar fusions typically involve incisions in both the front and the back of the spine. Each one would be at least 4 inches long. And the patient would have a very, very long recovery. There would be significant blood loss. Now, with minimally invasive lumbar fusion surgery that we do here at NeuroSpine Plus, a surgery can be done through 2 1-inch incisions in the low back, and the patients can go home the next morning. They're walking right away. Technology that has allowed us to perform surgeries through a more minimally invasive approach involve changes in the instrumentation, where we now have very small tubes and dilators that allow us to move the tissue out of the way as opposed to cutting it. There are also image guidance technologies which allow us to touch a patient with a probe and see on the monitor exactly where we are in the patient's body. There's also been changes in neuromonitoring. That's something I particularly myself have been involved with, making surgery safer through the use of neuromonitoring. And all of these components put together allow for a much safer and more minimally disruptive experience for spine surgery. If you have any questions regarding minimally invasive surgery or whether your condition could be treated via minimally invasive surgery, please reach out to our office for consultation.